Hi, everyone. Welcome to today's live broadcast, PARACTIN in Inflammatory Processes, Muscular and Joint Health. I'm Melissa Maripodi, the Custom Content Editor of Nutritional Outlook, and I'll be your moderator for today's event. This symposium is presented by Nutritional Outlook and sponsored by HP Ingredients. HP Ingredients Corporation was founded in 2001 by Annie Eng and is a manufacturer and supplier of safe, branded, patented, science-based, clinically proven nutraceutical herbal extracts. HP Ingredients' mission is to maintain its reputation as a foremost pioneer in the global natural health industry by delivering unique ingredients backed by rigorous scientific research. The company is a fast-growing, innovative nutraceutical company that brings to market standardized patent botanical extracts and privately funds clinical studies in collaboration with globally prestigious universities and research institutes located in Malaysia, Chile, Italy, and the United States in support of these products. HP Ingredients' specialized services include custom product development, contract manufacturing services, and private labeling of cutting-edge dietary supplements and nutritional products. We have a few important announcements before we begin today. This symposium is designed to be interactive, so we encourage you to ask questions during the event. You can submit them by typing them in the Q&A box that's found on the right-hand side of your screen. You can enlarge the slide window by clicking on the small square icon in the upper right-hand corner of the slide window, or by hovering your mouse over the lower right-hand corner and dragging the window to the desired size. The slides will advance automatically during the event. If you have any technical problems viewing or hearing the presentation, click on the question mark help widget in the dock at the bottom of your presentation window. I would now like to introduce our speaker for today. We are pleased to be joined today by Dr. Juan Honke. Juan is the Scientific Director of HP Ingredients, a Doctor of Veterinarian Services, and is full professor at the Institute of Pharmacology at the Austral University in Chile. He was awarded postdoctoral fellowships at 3 institutes, including the Max Planck Institute for Biophysical Chemistry and at the World Health Organization at the Charing Cross Hospital, Faculty of Medicine, University of London. He is a pioneer in medicinal plants investigation and has published over 70 scientific papers and 20 patents. Thank you for joining us today. Juan, go ahead and get us started.
Thank you. And thanks for being here and welcome to PARACTIN. PARACTIN, in a nutshell, is a nutraceutical, safe, unique, standardized, patented, science-tested, and sustainable harvest. The main botanical of PARACTIN is a medicinal plant known as Andrographis paniculata. There it is, the plant on the left side. It's a beautiful white flower, small ones, and it grows like a bush. And you can find it mainly in India, in the plains of India, in China, in the northern peninsula of Thailand, in Java, Indonesia, and nowadays is most wild growing and cultivated. The ethnobotanical use, if we go to the ancient tradition, Andrographis paniculata has been used in the Chinese system of medicine for more than 2,000 to 3,000 years, and also in India in the Ayurvedic system of medicine. It is already indexed in the Western in 1901 in the text of Pharmacology and Therapeutics, and in the Pharmacographica Indica in London in 1890. The chemical structure was established by Gorter in 1911, so more than 100 years ago. And there is an interesting point on this plant because it was used as a food ingredient, despite the fact that it is an extremely bitter substance. It is named as one of the king of the bitters and is indexed by the Ministry of Agriculture, Fishery and Food in England and the Council of Europe in 1981. Andrographis has a long tradition as a herbal remedy in gastric disorders as anti-inflammatory, and treatment of symptoms of common cold, mainly in the Western world. And back in 1997, it was done a monograph as a traditional by the World Health Organization, and now we count with a monograph for the Andrographis paniculata plant. What does it contain? The main constituent of Andrographis is known as Andrographolide. It is a bitter colorless neutral crystalline substance, and it contains mainly diterpenes, which is a class of chemical compounds that is synthesized by plants, animals, and fungi. And well, if you are a chemist, you can probably imagine that you can do many changes in the structure of the andrographolide and make analogs and synthetic compounds, which is the case that is happening nowadays. Our ParActin is a standardized dried extract containing 50% of total andrographolide, and here you see the HPLC, where you have the structure of andrographolide appearing at the retention time of over 5. Then you have the neo-andrographolide, and then the deoxyandrographolide appearing at almost 15 retention time. Then andrographolide and related compounds have a long history in inflammatory processes and have been tested in several animal species, reducing edema, fever, and inflammation. And if we can rank the effect of the 3 components that are in ParActin, the first one is andrographolide, followed by deoxyandrographolide and neo-andrographolide. Then the other interesting part is that it has lesser side effects than corticosteroids and common and non-steroidal inflammatory drugs. And the anti-inflammatory mechanism is supposed to be different from the conventional anti-inflammatory drugs. Now, if we make it simple and go to the mechanism of action of ParActin, one of the key factors, that controls many different diseases is the nuclear factor kappa B, which is called as the master key that controls different inflammatory processes, and is a family of transcription factors that regulate pro-inflammatory genes. And what ParActin does is to lower, so to say, inhibit the effect of NF-kappa B so that you have lesser inflammatory outcome. And here we will explore 2 diseases that go with a great deal of disability, which is multiple sclerosis, and on the other hand, arthritis. How does it look this into the papers that we published back in 2005? We, together with a group of Chinese, were the first to describe the effect of andrographolide on the interference with NF-kappa B. In neutrophilic cells, they did it on another type of cells, on endothelial cells. And here on the upper left side, you can see andrographolide, a Western blot, where the lines, the intensity of the color dark, says that it's a high intense or not activity. And on here you have the effect of the PAF, which is a platelet activating factor, and you can see there is an intense reaction. And when we add the different concentrations of andrographolide, there is a decrease in the intensity of the reaction. And this is here plotted, and you can see with the different concentration of andrographolide, there is a decrease in the activity. And the same when we add another type of activation of the cells. On the right hand, you have also the Western blot showing the COX-2 activity. When you have the puff, you have an intense black line, and when you add the andrographolide, you have the inhibition of the activity. If we go to the next slide, you can see the nuclear fat function, which is of T cells, and this is another type of cells that are activated. And when you have the interleukin-2 activity increased by PMA, and when you add the cyclosporin, which is an immunosuppressant, you have the inhibition of the activity, and with the different concentrations of andrographolide, 10, 50, and 100 micromolar, you have the inhibition of the activity of the interleukin-2, and also of the NFAT activity, and also of the nuclear factor kappa B. So if we could have a summary of the mechanism of action, basically any stimulus that acts on the cellular membrane, like TNF-alpha, it can activate 3 pathways. One is the NF-kappa B that produces, the interference of pro-inflammatory genes. Then the NFAT that is activated by the phosphorylation of the Jung terminal kinase. And then on the other hand, we have the inhibition of the STAT3 by the phosphorylation, and this is another path, that is involved in the mechanism of action of PARACTIN. Now, if we take multiple sclerosis, it's an autoimmune disease that is characterized by inflammation and neurodegeneration within the central nervous system. It affects 2,050 to 350 patients in the USA. In Europe, 400,000 patients, and worldwide between 2.5 and 3 million. The hallmarks of the disease is that 85% of the population have a type of relapsing remitting form of the disease. That means there are periods where the patient has no inflammatory outcomes, and then periods, where there is the inflammation going on. And then of these relapsing remitting form of the disease, 50% goes into the secondary progressive form of the disease. And there is another group of patients that from the very start go to primary progressive form of multiple sclerosis. The interesting thing is that 80% of all the MS patients are affected by fatigue. And there is a great deal of disability in the walking and the numbness and tinglings of different parts of the body, muscle weakness, stiffness, spasm, and there is a problem of balance and coordination. Treatment, nowadays the most used are the disease-modifying drugs, which reduce the incidence of the relapses in the recurrent remitting form of the disease. But however, 1/3 of the relapsing remitting patients do not respond to the first line of therapies, which are interferons. And nowadays, there are practically no treatment for the progressive form of the disease, which is 50% of the patients. And there is few effective treatment for the fatigue symptoms so far. Back some time ago, we did some effect on the studies on the effect of Andrographolide in the experimental autoimmune encephalitis model of the disease, where we studied the clinical score with placebo during the period of the disease. We give interferon beta, and in blue you have the Andrographolide every second day, and you can see that there was a significant decrease in the clinical scores of the disease, similar, to the interferon beta. We published this in some time ago, where Andrographolide interferes with T cell activation, reducing the score of the experimental autoimmune encephalomyelitis in the mouse. This prompted us to do a clinical study in patients suffering from MS in the relapsing remitting form, and this was a placebo-controlled study for 12 months and double-blind, and we can see that after a period of 12 months, there was a significant decrease in the fatigue as compared to day 0. Then we did another one on the efficacy of Andrographolide in the progressive form of the multiple sclerosis. Was a double-blind, placebo, parallel controlled, randomized study, and the main outcome was brain atrophy, and we can see that the group in green, represented here, has a lesser brain atrophy as compared to the placebo, and also there was a ameliorated brain parenchymal and reduction. And also in the 3 months disability progression endpoint, Andrographolide did far better than the placebo group. Now, if we go to the second part of the disease, which is rheumatoid arthritis, as it is known, an unknown trigger promotes inflammation in the synovial membrane, attracting leukocytes and into the tissue. And this autoreactive CD8 cells activate the macrophage, resulting in pro-inflammatory cytokine production. There they are. And this, again, induce metalloproteinase and rank ligand production, which is a ligand activator of NF-kappa B. And the end result is that the osteoclast, start to erode the cartilage. We explored the double-blind placebo-controlled study done here at the hospital, the effect of ParActin on rheumatoid arthritis, and this was in a group of 60 patients, 30 placebo and 28 active. And the results showed that there was a reduction in tender joints, significantly in the total grade of tender joints and rheumatoid factor. Then we also published in the book called Andrographolide as a new potential drug for the long treatment of rheumatoid arthritis, and in different cases of patients diagnosed with rheumatoid arthritis, rheumatoid spondylitis, arthritis vasculitis, psoriatic arthritis, rheumatoid arthritis serositis, and psoriatic arthritis erythroderma. And with the prevalence of the disease for many years, and the duration of the treatment went from 38 months up to 60 months. So really for a very long period of time. And the results showed that there was a decrease in the erythrocyte sedimentation rate, C-reactive protein, also in rheumatoid factor, stiffness, reduction in pain and fatigue. Remember also this observation we saw in the patients suffering from multiple sclerosis. And now if the person suffering from rheumatoid arthritis, they can go into osteoarthritis, And if we look into some of the osteoarthritis facts, knee is one of the most frequent forms of the disease, up to over 60% of the disease. And over the years, it will increase if we take from the year 2012 to 2032, it will increase in both men and women. So we will have a higher prevalence of knee osteoarthritis. And there is also the risk of knee osteoarthritis in obese patients. If we look at the history of osteoarthritis, it's a long history back into the 1800s, and up to today, there is no drug therapy that effectively holds the progression of osteoarthritis. And there is many preclinical studies that have shown that the Andrographolide, the active of ParActin, is able to inhibit the matrix methylproteinase and inducible nitric oxide synthetase, as you can see here, in the production of the metalloproteinase 1 and 13 is decreased with the different concentration of the Andrographolide. And back in 2018 and 19, we conducted a double-blind, placebo-controlled study to study the efficacy of Andrographis paniculata on pain reduction in subjects with knee osteoarthritis, and using a WOMAC total score. We were using two different concentrations of ParActin 300 milligrams and 600 milligrams per day to show clearly that there was a reduction in the pain in patients with knee osteoarthritis. Now, if we make a comparative chart in knee osteoarthritic products, taking ParActin and non-steroidal anti-inflammatory drugs, paracetamol, chondroitin, sulfate, glucosamine, on opioids, most of them produce a pain reduction. And in the case of ParActin, it has few adverse events. In the case of non-steroidal anti-inflammatory drugs, there are some adverse events that limits its use. An example can produce heart attacks, bleeding, ulcers, etc. In the case of paracetamol, there are also adverse events that limit its use, particularly hepatic damage if you use high doses over 3 grams, and also kidney disease. And in the case of chondroitin, sulfate, glucosamine, it has few adverse events. In the case of opioids, it causes tolerance and addiction, which is a problem in long treatments, and there is a risk of severe adverse reaction, particularly respiratory arrest. The interesting point in the case of ParActin is the inhibition of joint catabolic processes and the prevention of joint erosion. None of the other products, including non-steroidal anti-inflammatory drugs, paracetamol, chondroitin, or opioids, are able to have any effect in controlling the progress of the disease. At present, we are doing a study in India. You can see it search it on ClinicalTrials.gov. There's the identifier on knee osteoarthritis to particularly study the effect on pain and if ParActin is able to affect the progression of the disease. Up to, as stated before, there is not a single product today that is able, after 6 months, to stop the progression of the osteoarthritis disease. And the main primary objective is to evaluate the effect of ParActinis or change in the joint space narrowing in tibiofemoral joint of knee measured by MRI in comparison to a placebo after 336 days. And here you can listed the secondary outcomes, which is the change in cartilage thickness of femur, tibia, and patella by MRI, the change in cartilage turnover parameter as assessed by change in serum levels of cartilage matrix protein, change in knee pain as assessed by WOMAC, the change in knee joint mobility as assessed by total WOMAC, and also the change in quality of life using the SF-36 score. Now, if we look into the effect of ParActin in muscular weakness, particular dystrophy, here you have the skeletal muscle architecture. If we make a cut through a healthy, normal muscle, here you have the bundles of muscles with the dots here representing the nucleus. And when you have on the lower part, you can see when the muscle suffers from fibrosis, you can see that the muscle bundles are decreased and there is space in between, showing that there is the fibrotic process. To have a summary of this process of the skeletal muscle formation, regeneration, and fibrosis, here you have the normal skeletal muscle. Through chronic damage, there is fiber degeneration and inflammatory infiltration with different inflammatory cells, as you can see here, and this provokes the release of cellular signal, the fibrosis, and inflammation. And this process, can just regenerate via satellite cell activation, via the proliferation, differentiation, and the regeneration of new skeletal muscle. But in some cases, in some diseases like, for example, Duchenne, this process is affected and cannot regenerate the cells, the muscle cells. We investigated the effect of Andrographolide in attenuating skeletal muscle dystrophy in MDX mice, which is a model of Duchenne disease, and we concluded, after some studies that the Andrographolide could attenuate muscular damage. Here you have the bundles of healthy muscle. In the MDX mice, you can see the muscles already affected and the great infiltration of inflammatory cells. And on the right, you have the MDX mice plus the Andrographolide, and you see that it's more or less similar to the control group. And here you can see the serum creatinine kinase. You can see that it is reduced in the group giving the Andrographolide. So at present, we are in the pipeline summary of clinical trials, period 2020-2023. We are an ongoing study. Already all the patients are recruited on the, if I'm correct, on the third month of treatment with ParActin. And then there's another ongoing on the immune and a third one on muscular dystrophy, where we will also study probably sarcopenia. So ParActin is a self-affirmed GRAS, and some of the claims in the industry is that it supports healthy inflammatory response, supports healthy joint function, eases joint flare-ups, improves flexibility, mobility, maintains bone mass and strength, supports healthy muscle, and supports healthy cartilage. ParActin is clean and sustainable, is BSE-free, non non-GMO, vegan, wild-crafted, non-irradiated, TSE-free, certified kosher and halal, and is available in organic and conventional form. Therefore, ParActin fulfilled these high demands. So I would like to thank Dr. Acárcamo, which did all the studies in multiple sclerosis at the University in Santiago. He's a well-known researcher worldwide. Dr. Burgos for doing all the studies in the different animal models, and Professor Brandam from the Catholic University that has done all the studies in fibrosis together with the University of California. So thank you, and we hope to meet you at the Supply Southwest.
All right, thank you, Juan, for your great presentation. Before we get started on the question and answer session, I want to remind our audience how to submit them. Just type them in the Q&A box that's found on the right-hand side of the presentation window. And the first question is, what are the adverse events of ParActin when used for arthritis in long periods of time, such as over 6 months?
Yes, ParActin, has been used in different types of arthritis, and the types of adverse events one can report is flatulence, dyspepsia. Some patients might feel some nausea, headache, and dysgeusia, but this is in less than 1% of the population. And so this is the type of adverse events that we have seen in our studies.
Okay, and the next question is, you mentioned the possible use of ParActin in muscular dystrophy. What types?
Yeah, the main muscular dystrophy that the main type is Duchenne, which is a genetically inherited disease, and it affects most of the muscular dystrophies. And it affects children when they begin to walk. And unfortunately, by the age of 20 and so on, it's a disease that brings death. And then there is the Becker muscular dystrophy that appears more lately in life, and which is more a mild form of the disease. So all this type of this muscular dystrophy could be of interest to study.
Okay, thank you. And is ParActin GRAS for use in beverages?
Sorry?
Is ParActin GRAS for use in beverages?
I do not know that answer. I know it's self, but I do not know. For beverage, I do not know.
Okay, thank you. And the next question is, the 336-day trial, has it been completed yet?
No, it's on 3 months. All the patients are recruited. There are 90 patients recruited, and it's on day, if I'm correct, 92.
Okay, and in the Hidalgo Maria book, the results for stiffness, fatigue, and pain were all significant?
Yes, correct.
Okay, unfortunately, we are out of time for today. I'd like to thank our audience for attending and participating in today's event. I would also like to thank our sponsor, HP Ingredients, for making today's educational symposium possible. We would like to ask everyone in the audience to participate in a brief survey that's found on the right-hand side of your screen. You will receive an email alerting you when the symposium is available for replay, and we invite you to forward that announcement to your colleagues who may have missed today's live event. And we received a question regarding a specific slide, so you'll be able to review the slides once it's available for replay. All right, thank you everyone for joining us. We will see you next time. Goodbye.